Hi, Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. I'm going to talk very specifically in this video about erectile dysfunction. There's another video just on male health, but let's talk about erectile dysfunction. Guys, don't get embarrassed about this. Yes, we do. It's always okay because sexual function is just biologic the vast majority of the time. Yes, occasionally it's psychologic, but most is just biologic, meaning there's something not working quite right. So the vast majority of erectile dysfunction or problems with maintaining or getting an adequate erection have to do with blood flow in and then the veins collapsing. So because there are valves in the veins that go like this so the blood doesn't flow out. And there are specific ways of addressing this which are really interesting and novel. So one of the things you can do is, I think most guys know this, is there's things like Viagra or Cialis, which is a medicine that helps dilate preferentially the penile artery so you get blood flow in. So those are things you can take either daily or you can take them just as needed. And they can be very helpful. They have side effects and some risks. But again, very standard, sometimes covered by insurance to an extent, blah, blah, blah. So, but there's that area. There's shots in the penis, the trimix, which is prostaglandins, which can give an immediate erection or shortly thereafter. Again, can be very helpful, has some negatives. One, it's a shot in the penis for every time. Second, you can get scarring from it, and so long-term it can cause problems. So what else is there besides those kind of standard things? Well, there's the third thing is you can get a penile pump, meaning you have an incision in your penis and they put a pump in and you push out it and you inflate your penis with air basically, and so you get an erection. That's very not exciting for most guys, but it's definitely out there and a choice. So what do we have that can actually potentially have some other major impacts? Well, one, which is particularly interesting, is using ultrasound energy into a target tissue. If this target tissue in this case is a analog for a penis, and you put an ultrasound probe here and it puts high intensity ultrasonic waves into the penis and then in the groins and areas, you agitate that tissue and that causes stem cell activation and release of mediators and causes the arteries to dilate and it makes the veins recollapse. So a treatment course of that can be potentially very helpful for erectile dysfunction. That's one thing. Second thing, people have used platelet-rich plasma or platelet-rich plasma derivatives, which is just a concentration of the healing portions of platelets. And plasma has an injection into the penis. There's minimally manipulated mesenchymal stem cell-derived nanoparticles, or things that are derivatives of stem cells that you can potentially inject in the penis and try to get re-engorgement of blood vessels and healing and get inflammation out, because you always want inflammation out. So that's kind of some of the new trends with this, where you can actually do some stuff to look or evaluate this in a different way as compared to the prior ways. And so we're always accepting patients for these discussions. So always feel free to call the office if you want to talk about it. Thank you.